Knock, knock. Hi, it's Irene. I'm back. I'm here to do Trach Care. Okay. So let me close the door. Let me pull the curtains so we can provide for privacy. Okay. And then what I'm going to do is wash my hands. Okay. And then I'm going to check and see who you are. Could you tell me your name and date of birth? Okay. Thank you. I'll check the computer. That's who you are. All right. So what we're doing is going to be doing cleaning of the trach. Okay. So the first thing I'm going to do is I'm going to do my supplies. Well, I guess I should probably put this around you first. This is cloth. A little placemat there. And then I'm going to go over here to the table and let my professor see that I have my table set up. I have my supplies here. Okay, I got my peroxide, normal saline. I have my mask and my gloves. Okay, and then I have my trach kit. Okay, so what I'm going to do before I go over to the bed is what I'm going to do is I'm going to raise the bed, pull down the side rail, put the head of the bed up like in a semi-Fowler's position, okay? And then I'm gonna make sure, ask the patient if she's in any pain, and if she is Miss Maggie's in any pain, then we can give her pain medicine. I'm also gonna make sure that she knows the procedure of why we're doing the trach care. It's just to make sure we're cleaning around the stoma, make sure there's not soil or anything there. So we're doing the trach care. And then ask Miss Maggie, does she have any questions? She says no. And then what I'm going to do is proceed to do care. She doesn't have any pain or anything like that, so I'm going to do that. So what I'm going to do now is wash my hands. I sanitize my hands. And then I'm going to empty out my trach kit. And then I'm going to put on dirty gloves or regular gloves. Okay. But in the meantime, what I'm going to do is take this out of the kit, put this down here, take out my gloves out of the kit. Okay. Empty everything out of the kit onto my pad there that came out of there. Now, this is the container that I'm going to put the liquids in. This is the normal saline, which goes in here where the peroxide goes. So it'll be half peroxide and half normal saline in the big container. And then normal saline to go here and normal saline to go here. Okay. And then the peroxide, I will mix a half peroxide and half normal saline. It depends on where you're going, what facility you work in. So I've already put all the fluids inside, so we'll make sure that you know. Like I said, this container, this part right here, the big one, will be for where the non-disposable cannula will be cleaned at with. That's with hydrogen peroxide and half hydrogen peroxide and half normal saline. This one right here, which is not so big, which I will do the cleaning around the stoma with Q-tips. This one right here is the bigger one. Once I clean the non-disposable cannula, I will rinse it out in here and then put it on a gauze that's sitting right here. Okay. All right. So before I do anything else, what I'm going to do is wash my hands again. Okay, or sanitize my hands again. Okay, and then I'm going to put on gloves, because what I'm going to do is take out her cannula and clean it. Oh, before I do that, well, I can put my gloves on again. I'll put my mask well, I better take them off just to be on the safe side. I want to put my mask and my gloves on just to make sure that everything's okay. Okay, so I'll put that over here, my mask and gloves. And then what I'm going to do is put my mask and gloves on. I just want to make sure that, just in case when I take out a cannula, that nothing spills on my face, so I'll just do that. So I got my mask and my gloves on before I take out my her dirty nasal cannula. And then what I'm gonna do is wash my hands again and then put my gloves back on. Okay. So let's put my gloves on. All right, got my gloves on. Now I'm gonna go back over here to Miss Maggie. I'm gonna bring my camera back over here so you can see what I'm doing to Miss Maggie. So what I'm doing to Miss Maggie is I'm gonna take her old split gauze off, the dirty one, throw it in the trash with a container there, okay? I'm gonna take out her nasal cannula, inner one, and then I'm gonna throw it into the dirty part, which I told you earlier where I was gonna put it at, and then hook her back up so she can still say have oxygen in it. Okay, now she's all set. Her dirty nasal cannula inner is out, and then she's hooked back up to oxygen. Okay, what I'm gonna do is take my gloves off, throw them away. Okay, sanitize my hands. Okay, and then I'm gonna move you back over here to show you what I'm doing. Okay. All right, now I'm ready to do the cleaning. So I've already sanitized my hands. Now I'm gonna put the gloves on, okay? Now this is a clean technique, so I have to be careful putting my gloves on, okay? All right. All right, let's do this. All right, me and my gloves. Gloves, gloves, gloves. Ooh. Okay. Okay. All right. Always need bigger gloves than these. I have to get me some bigger ones. Okay. All right. All right. Okay. All right. Got my gloves and everything on here. All right. So we're ready to clean her non-disposal or what cannula out. We'll just throw that in the trash. So I'm going to take the brush. All right. Bring this over here so you can see what I'm doing. I'm going to take this here, put the brush into the hydroperoxide and normal saline, and just in here and clean it out. Go all the way in and clean it out, brushing it out. Okay. And then I'm going to swish it around in there, get it out. And then I'm going to just take this, put it into the big one, like I said, swish it around, make sure it's clean, and put it on this right here. This is the gauze, okay? All right, and then I'm going to take this here Q-tip, dip it into the normal saline, that's the small one, and clean around the stoma. So, all right, I'm going to go here and here, throw it in the trash, get another one, dip it into the normal saline, around here and here, okay, and here. Now, so everything's clean. So what I'm going to do is take this or in a can and put it back on, okay? So what I'm going to do is, you see me? Make sure you see me. There you go. Okay. Maybe I'll just put it back over here so you can see me. So what I'm going to do is take it down, her oxygen down, put it in the cannula, put it back in, the cannula back in, making sure when I put the cannula back in that I'm holding the faceplate, okay? Put it back in and then hook her back up to oxygen. Okay. All right. It wasn't want to stay. There we go. And then, since I've already cleaned around her her stoma area, I'm just going to replace it with the split gauze. Okay. All right. Now, if I needed to do her straps around here, her tie straps that holds her nasal cannula in, her faceplate with her nasal cannula in, what I needed to do is normally with two people, one gets on one side, one gets on the other side, because of the fact that you don't want this to come loose when something might happen when there's only one person. So what you normally do when it's one person, you put the new tie straps on around here and make sure they're in place on both sides before you take off the old ones. Okay? So Miss Maggie is okay. She has her new split gauze on. She has her cannula's been cleaned and everything. So what I'm going to do now is take my gloves off. Okay. All right. And then I'm gonna throw everything in the trash. I'm gonna put the bed down. Okay. Pull the rail up and put her head down a little bit so she'll be in a good position. And ask Miss Maggie, does she have any problems or is anything going on or is she okay? And she says she's okay. Then I'm also going to make sure I move this too. All righty. So I think we're finished with that one. All right, bye. Oh, I forgot to move my glasses and my mask. That's part of the last thing that I needed to do. All right, thank you. Bye.